Hi everyone, welcome back. I'm glad you're here because today's topic is one that matters to so many of us: blood pressure. What if I told you there are 6 easy things you can do, right at home, to bring your numbers down in just a few minutes? That's exactly what we're going to cover in this video. Let me ask you something right away. What if you could lower your blood pressure in the time it takes to brush your teeth? What if you could feel calmer, lighter, and healthier without swallowing a single pill or using any fancy machine? Sounds impossible, right? Well, not really. In this video, I'm going to walk you through 6 simple science-backed techniques that you can do right now, wherever you are, to bring your blood pressure down and feel better almost instantly. Stick with me until the end, because not only will you learn these powerful tricks, you'll also discover which of them can create long-term benefits for your heart and arteries if you practice them regularly. Understanding blood pressure. Before we get into the fun part, let's pause for a moment to really understand what blood pressure is and why it matters so much. Blood pressure is simply the force of blood pushing against the inner walls of your arteries every time your heart beats. Think of your arteries as flexible garden hoses that carry oxygen-rich blood to every organ, from your brain to your toes. Just like a hose can be under gentle pressure or blasting full force, your arteries also feel that push from the blood inside them. It's measured with 2 numbers. The top number, called systolic blood pressure, is the pressure created when your heart squeezes and pumps blood out to the body. The bottom number, called diastolic blood pressure, is the pressure when your heart is resting between beats. So, when you see a reading like 130/80, it means your heart is pushing blood out at 130 millimeters of mercury during the squeeze, and the resting pressure in between beats is still at 80. Now here's the part many people miss. Blood pressure naturally changes throughout the day. It rises when you're active, excited, or stressed, and it falls when you're calm or sleeping. That's normal. The real problem comes when it stays high all the time, even when you're resting. That's when it turns into hypertension. And here's the scary truth. Hypertension is often called the silent killer. Why? Because most of the time you don't feel it. There's no pain, no obvious warning. Yet quietly, it puts extra strain on your arteries, making them stiffer and narrower, which in turn forces your heart to work harder. Over time, that hidden stress can damage your heart, kidneys, eyes, and even your brain. To give you perspective, according to the American Heart Association, normal blood pressure is anything below 120/80. Numbers between 120 and 129 are considered elevated. Once you consistently hit 130/80 or higher, that's when it's labeled hypertension. And with every 20 points your systolic goes up, or every 10 points your diastolic goes up, your risk of heart attack and stroke just about doubles. But here's the good news. Your body is remarkably smart. Built into your arteries and your nervous system are sensors and reflexes designed to adjust pressure in real time. And that's exactly what the 6 techniques we're about to cover take advantage of. They're safe, natural ways of tapping into your body's own control system to nudge those numbers back down sometimes in just a few minutes. Technique 1. Carotid Massage. Let's begin with something fast, powerful, and surprisingly effective: the carotid massage. Here's how you do it. Take 2 fingers and place them gently on the side of your neck, just below the angle of your jaw. You'll feel your pulse there. That's your carotid artery, one of the main highways carrying blood from your heart to your brain. Once you find the pulse, slide your fingers slightly outward and gently massage that spot with moderate pressure for about 5 to 10 seconds. Now, what's so special about this area? Inside that spot is something called the carotid sinus. You can think of it as a built-in pressure sensor, a tiny biological gauge constantly monitoring your blood pressure. It's part of a larger system called the baroreceptor reflex. Here's how it works. When you apply gentle pressure to the carotid sinus, those baroreceptors send a signal up the glossopharyngeal nerve straight to the brain stem. Your brain interprets this signal as, "Whoa, blood pressure is too high." In response, the brain tells the heart to slow down and the blood vessels to relax. The result? A quick dip in both heart rate and blood pressure. It's almost like tricking your body into pressing the brakes on the cardiovascular system. To make it even clearer, imagine a thermostat in your house. When it senses the room is too hot, it tells the air conditioner to cool things down. The carotid sinus works the same way when it feels pressure. It signals the body to lower it. Now, while this is incredibly effective, it also comes with an important caution. Don't overdo it. A short, gentle massage for a few seconds is all you need. Pressing too hard or for too long can cause your blood pressure to drop too far, which may make you feel dizzy or even faint. In fact, doctors sometimes use carotid massage in a hospital setting to treat certain abnormal heart rhythms. But in that environment, patients are closely monitored. At home, it should only be used as a quick, careful trick, not a daily habit. So remember, use it sparingly, be gentle, and if you have any history of carotid artery disease, stroke, or plaque buildup, skip this method entirely and consult your doctor. Safety always comes first, but when done correctly, this technique is like flipping a hidden internal switch, instantly calming your heart and circulation. Technique 2. The Valsalva Maneuver. The second method is called the Valsalva Maneuver, a name that sounds complicated, but the action itself is surprisingly simple. Here's how you do it. Sit upright in a comfortable position. Take a deep breath in through your nose, filling your lungs. Pinch your nostrils shut with your fingers. Close your mouth. Try to exhale as if you're blowing up a balloon, but don't actually let any air escape. Hold that pressure in your chest for about 5 to 10 seconds, then release slowly. Now, why does this strange maneuver actually lower blood pressure? The secret lies in how it changes the pressure inside your chest cavity. When you bear down like that, the increased chest pressure temporarily reduces the return of blood to your heart. In response, your body activates the vagus nerve, the body's natural brake pedal, which slows down your heart rate. As the heart slows, blood vessels relax and blood pressure drops. It's a fascinating demonstration of how closely our breathing, nervous system, and circulation are linked. To make it easier to picture, think of your cardiovascular system as a busy highway. When traffic gets too fast, accidents happen. The Valsalva maneuver is like a traffic cop briefly stepping in, slowing everyone down, and restoring order. Doctors sometimes use this technique in medical settings to treat certain abnormal heart rhythms, like supraventricular tachycardia. In those cases, it can quickly bring a dangerously fast heart rate back to normal. But here's the caution. Don't overdo it. Holding your breath and straining too long can make you lightheaded. Always keep it short, about 5 to 10 seconds is enough. And if you have heart disease, lung problems, or glaucoma, talk to your doctor before trying it. Still, when done correctly, the Valsalva maneuver is a powerful tool, like pressing a hidden reset button for your circulation. Technique 3. Box breathing. The third method is one of the simplest yet most powerful ways to bring your blood pressure down. Box breathing. At first glance, it seems too easy, just controlled breathing in a 4-part rhythm. But don't let the simplicity fool you. Behind this technique is solid science showing how the way we breathe can directly control the way our nervous system behaves. Here's how to practice box breathing. Inhale gently through your nose for 4 seconds. Hold your breath for 4 seconds. Exhale slowly through your nose for 4 seconds. Hold again, lungs empty, for 4 seconds. That's 1 cycle. Repeat it 4 or 5 times, and you'll notice your heart rate slowing, your shoulders dropping, and your mind becoming calmer. So what's happening inside your body during this? When you breathe slowly and rhythmically, you activate the parasympathetic nervous system, the rest and digest side of your body. This system releases calming signals, lowers stress hormones like cortisol, relaxes blood vessels, and reduces heart rate. All of these combine to bring your blood pressure down. On the flip side, when we're anxious or stressed, our breathing becomes shallow and rapid. That's controlled by the sympathetic nervous system, the fight or flight response. Chronic, shallow breathing keeps the body in a state of alert, which raises blood pressure. Box breathing works like an antidote, pulling you out of fight or flight mode and into a calmer, healthier state. To put it in perspective, think of your breath like the steering wheel of your nervous system. Shallow, fast breathing drives you towards stress and high blood pressure. Slow, deliberate box breathing turns the wheel back toward relaxation and balance. This technique is so effective that it's used by Navy SEALs, pilots, and first responders, people who need to stay calm under extreme pressure. If it works for them in combat or life and death situations, imagine how powerful it can be for lowering blood pressure at home. And the best part? You can do it anywhere while sitting in your living room, before bed, or even in the car. Just not while driving, please. One extra tip. As you practice, visualize a glowing square or box in your mind. Trace each side of the box as you inhale, hold, exhale, and hold again. This mental image makes the rhythm easier to follow and deepens the relaxation. Just 2 or 3 minutes of box breathing can lower your systolic blood pressure by several points. If practiced daily, it can even train your body to be less reactive to stress overall. Technique 4. Ear massage. The fourth technique may sound unusual, but it's surprisingly effective. Ear massage. Here's how you do it. Use your thumb and index finger to gently massage the inside part of your ear, especially near where the ear canal begins. Apply light, circular pressure, not too hard, just enough to feel soothing. Continue for about 90 seconds. At first glance, it might feel like nothing more than a gentle ear rub, but behind this simple action lies a fascinating neurological pathway. By massaging your ear, you're stimulating the auricular branch of the vagus nerve. Now, the vagus nerve is one of the most important nerves in your entire body. It runs from your brainstem down through your neck and into your chest and abdomen, touching your heart, lungs, and digestive organs along the way. You can think of it as the body's superhighway of relaxation. When you activate the vagus nerve, you trigger your parasympathetic nervous system, the body's natural brake pedal. This shifts you out of the fight or flight state and into a rest and digest mode. The result? Your heart rate slows, your blood vessels relax and widen, your blood pressure decreases. Some researchers call this a neuroanatomical shortcut, a way to calm the body by accessing the vagus nerve externally, without meditation, medication, or even lying down. In fact, clinical studies have shown that auricular acupressure can lower systolic blood pressure by about 5 to 8 millimeters of mercury in just a couple of minutes. That's the same effect you might see from some mild blood pressure medications without the side effects. To put it in simple terms, ear massage is like a secret back door into your nervous system. By rubbing the right spot, you're sending a direct message to your body. It's safe. Relax now. And the best part? It's quick, discreet, and you can do it anywhere while sitting at your desk, watching TV, or even lying in bed. Safety note: always be gentle. Don't press too hard or dig inside the ear canal. The goal is soothing stimulation, not discomfort. If you feel pain, stop immediately. Technique 5. The 60-second body scan. The fifth method is called the body scan, and it's one of the most powerful ways to calm both the mind and the body in just a minute. Here's how you do it. Sit down comfortably in a chair with your feet flat on the floor. Rest your hands on your lap, close your eyes, and take one slow breath. Now, bring your attention to your feet. Notice exactly which parts are touching the ground. Are your heels pressing into the floor, or the balls of your feet, or maybe the outer edges? Imagine a gentle, warm mist surrounding your feet. Let yourself feel it for a moment. Slowly move your attention upward. Ankles, calves, knees, thighs, abdomen, chest, shoulders, jaw, and finally, the top of your head. At each stop, notice any tension and allow that area to soften and release. The whole process takes just about 60 seconds, but the effect can be profound. So why does this work? The secret lies in how stress affects your nervous system. When you're worried, rushing, or overwhelmed, your body activates the sympathetic nervous system, the fight-or-flight response. Your heart beats faster, your blood vessels tighten, and your blood pressure rises. But when you perform a body scan, you shift your focus away from racing thoughts and anchor it in physical sensations. This sends a powerful message to your brain. We're safe. That activates the parasympathetic nervous system, which lowers heart rate, relaxes blood vessels, reduces blood pressure. It's the same principle that makes mindfulness meditation so effective, but the body scan is faster, simpler, and doesn't require years of practice. Think of it this way. If your body is a computer that's running too many programs at once, the body scan is like hitting reset. It clears the background noise and brings everything back into balance. And the more you practice, the better it gets. Over time, you can learn to do a full scan in less than a minute, and your body will respond more quickly each time. Some people even train themselves to use it as an emergency brake whenever they feel stress spiking. Practical tip: try the body scan before bed. It helps not only with blood pressure, but also with sleep, because it quiets the mind and relaxes the muscles. Technique 6. Warm foot, soak. The sixth and final technique is perhaps the most relaxing of them all, the warm water foot soak. Here's how you do it. Fill a small tub, basin, or bucket with comfortably warm water. It should be warm enough to feel soothing, but never hot enough to burn. Place your feet in the water and let them soak for 10 to 15 minutes. For an extra benefit, add a handful of Epsom salt, magnesium sulfate, to the water. Magnesium is known to help relax muscles and calm the nervous system. Within just 2 to 3 minutes, you'll start to feel the tension leave your body. Stay for the full 10 to 15 minutes, and your blood pressure can drop noticeably sometimes by as much as 10 millimeters of mercury in systolic pressure. Now, why does soaking your feet in warm water help lower blood pressure? The explanation is simple but powerful. Warmth causes vasodilation, your blood vessels widen. When you soak your feet, the small arteries in your legs and feet open up, allowing more blood to flow to the lower part of your body. This shift reduces resistance in your overall circulation, making it easier for your heart to pump blood and lowering your blood pressure. It's almost like opening more lanes on a highway. When traffic spreads out, congestion eases. In the same way, when blood vessels in your feet and legs widen, pressure throughout your system comes down. There's also a second effect. Warmth stimulates the parasympathetic nervous system, the same calming system we've talked about in other techniques. This double action, wider blood vessels plus a relaxed nervous system makes the foot soak especially effective. Even better, when practiced consistently, say, 4 or 5 evenings a week, it doesn't just give you temporary relief. Studies suggest it can help maintain lower blood pressure over time. It becomes part of a long-term lifestyle habit that supports heart health. And let's be honest, it just feels good. After a long day, sitting back with your feet in warm water is soothing not only for your body, but also for your mind. Many people find they sleep better afterward, which itself is another way to improve blood pressure control. Safety notes. Always check the temperature before putting your feet in, especially if you have diabetes or poor circulation, as your skin may be more sensitive. Don't use water that's too hot, and don't soak for more than 20 minutes. If you experience dizziness or discomfort, stop immediately. Important precautions. Now, a word of caution. These techniques are powerful. They can lower your blood pressure quickly. That's good if your numbers are too high, but you don't want to overdo it. Don't repeat them too many times in a row, or you could drive your pressure too low and feel faint. And remember, if you have chronically high blood pressure, these tricks are not a substitute for proper medical care. Always talk to your healthcare provider before making changes to your health routine. So there you have it, 6 simple drug-free ways to lower your blood pressure instantly. Which one do you want to try first? The quick carotid massage, the mindful body scan, or maybe the soothing foot soak? I'd love to hear from you. Drop a comment down below and share your experience. If you found this video helpful, give it a like, and don't forget to subscribe for more practical health tips. Remember, your health is in your hands. Small actions every day can make a huge difference for your heart, your brain, and your future. Thank you for watching, stay well, and I'll see you in the next one.